share?
So for me, as with any cancer diagnosis, I really felt like time was of the essence. And I wanted to first prioritize getting my care team in place. Because I felt like once that care team was in place, then that could set wheels into motion and actions would be taken, appointments and scans and tests, that kind of thing. And for me, that meant one, getting recommendations, looking at hospitals, institutions, whether it be Johns Hopkins, and I got several recommendations. But in addition to researching that each hospital, I primarily, as a priority, focused on researching the individual, each individual surgeon, because at the end of the day, I wanted to be confident that I had the best pancreatic surgeon that I could possibly have. And that just meant understanding how many surgeries they did, what specific area of the pancreas did they focus on, what specific area of disease did they focus on, and doing that level of research to then be able to make a comfortable choice about which doctor. And then once that decision is made and that those wheels are set into motion, secondly, I would say it's, researching and inquiring, doing the deep dive research to understand specifically what my diagnosis is, what your diagnosis is, to understand what your tumor is. And for me, that meant a pancreatic neuroendocrine tumor, which is actually a very rare form of cancer in the pancreas. So I really had to reach out, both using the internet, talking to doctors, talking to current patients, to understand the resources they used to understand the diagnosis and treatment options. And once you've researched, you can, as we've been saying already, then you can come prepared with lists of questions for every single doctor visit, so that you know what is it that I need to know to be both comfortable and confident in the care that I'm going to receive. And I'd say also, as just echoing, everything you've said, Tony, everything you've said, Cheryl, is kind of the theme of insist and persist. Insist on the best care that you can get. Insist on coordinated care. And persist. Persist means, just as you were saying, Tony, don't stop at the first answer that you get. If in your gut, you're not feeling that comfort and that confidence that's what's the best option for you. So the persistence is to keep asking, to keep pushing for until you feel comfortable with the answer, until you feel comfortable with the approach for your care. And I love too what you emphasized, Cheryl, was that no question is a bad question.
That's right.
Every question is a good question. And so in your mind, if you're having any hesitant or doubt, I would just say, ask away. Whenever in doubt, inquire. Keep asking the questions and don't stop until you, again, get the answers and the care that you want.
Do not, under any circumstances, give your doctor full authority over your body. I know they went to school for 2,000 years. I know they have more degrees and plaques on their walls and their offices than you could ever imagine, but this is your body. And your body is truly your responsibility. You are not a textbook. That is what I said, from my primary care to every member on my nursing team, to the radiologist, oncologist, and every surgeon in between. This is my body. And I know when something is out of whack. And I get that your textbooks say, oh, if the patient complains of pain, then prescribe a pill. But I complained of pain and was prescribed the pill and ignored that and went to my next doctor's appointment and complained of pain and found out that my port was in upside down. This was 3 hours before my first chemo treatment. I had a bulge on the side of my neck. So please don't ever just abdicate your throne as the CEO of your body and, the one in charge of your cancer. Your team is just that, but you are still the coach. You got to be able to tell them what it is. And the second thing for me is, do not get caught up in the minutia of friends that sort of are in and out of your life. I call them, I have two types of friends. Okay. I have ride or die friends, the friends that have been with me forever through the diagnosis, before and after, and know what I need, you know, to get by. And then I have what even lovingly I refer to as fair weather friends. They're with me for their benefit. It looks good to do a photo op with the bald head Tony. Okay. Yeah, that was great. However, I had to tell myself fair weather meant it would be okay on stormy days when I wouldn't hear from them. So just sort of set your expectations that friendships could get a little squirrely during your journey, but as long as you stay true to who you are and you can articulate, okay, may not have to be as blunt as me. Are you a fair weather friend or are you a ride or die? But I did that because I needed to know how to categorize people during my treatment. Who can I call to go with me and my daughter to an appointment? Who can I call to bring over a casserole because I'm too sick to cook? Those are how I delineated who was going to be a real part of the personal care team. So those are my two recommendations.